everyone. In this presentation, I will be detailing my final paper, which is Responding to HIV/AIDS in South Africa. Despite the fact that sub-Saharan Africa contains only about 11% of Earth's population, the region is the world's epicenter of HIV/AIDS. Adult HIV prevalence is 1.2% worldwide, but it is 9% in sub-Saharan Africa. AIDS is now the leading cause of death in sub-Saharan Africa. Worldwide, AIDS is the fourth leading cause of death. The combination of high birth rates and high AIDS mortality among adults, including many parents, has meant that more than 90% of children who have been orphaned as a consequence of HIV in this region. Most of the world's affected countries form an AIDS belt in eastern and southern Africa. This belt consists of about 16 countries and stretches from Djibouti and Ethiopia down to the east side of the continent through South Africa. These countries constitute only a little more than 4% of the world's population, but account for more than 50% of HIV infections worldwide. And as you can see at the very bottom, South Africa is over 15% prevalence of HIV/AIDS, and that's why I chose to focus on South Africa for my topic. In South Africa, 60% of women have HIV. Nearly 4,500 South Africans are newly infected every week, and about one-third of those are adolescents and young girls, aged 15 to 24. The prevalence rate exceeds 15% among young adults. South Africa remains the epicenter of the HIV pandemic as the largest AIDS epidemic in the world. 20% of all people living with HIV are in South Africa, and 20% of new HIV infections occur there too. Young girls and women are disproportionately affected by HIV/AIDS compared to their male counterparts. In some age groups, the infection rate among young women is significantly higher than young men. The epidemic is exacerbated by its concentration in 15 to 49-year-olds, those of reproductive and working age who are the backbone of South Africa. Without aggressive action to reduce the rate of new infections in young people, HIV will continue to take a tremendous toll on the country for years and generations to come. Adolescents and young adults are at higher risk of HIV infection compared to older age groups. This includes young girls who may engage in sexual relationships with older men, contributing to their vulnerability. Many HIV-infected young women in South Africa had not had significantly more sexual partners than women of a similar age in developed nations. The mean number of lifetime sexual partners was 2.3, but HIV infection prevalence was almost 20%. Gender disparities and unequal power dynamics can make it challenging for young girls to negotiate safe sex practices or refuse unwanted sexual advances, increasing their vulnerability to HIV infection. Inadequate or lack of comprehensive sex education in schools and communities may lead to a lack of knowledge about HIV transmission, prevention methods, and safe sex practices. Some young girls may face barriers in accessing healthcare facilities or prevention services, such as condoms or PrEP, which could protect them from HIV infection. HIV/AIDS-related stigma can also prevent young girls from accessing testing, treatment, and support services, further exacerbating the spread of the virus. Collective action is needed to push beyond the complacency and international barriers to implement policies and interventions that directly target HIV prevention and treatment for young women. The South African government has been implementing various educational and awareness initiatives aimed at young girls to educate them about HIV transmission, prevention, and treatment. These programs also focus on reducing stigma and promoting testing. The government has also been working to improve antiretroviral treatment for those living with HIV, including young girls. Antiretroviral therapy is crucial in managing the virus and improving quality of life for HIV-positive individuals. Preventing mother-to-child transmission of HIV is a critical strategy in reducing the number of infections among young children. The government has been expanding services to ensure that pregnant women living with HIV receive proper care and support. The South African government has been distributing condoms as a preventative measure to help reduce the spread of HIV, including among young girls and women. Specialized healthcare services for young people, including HIV testing and counseling, have been developed by the government to address the specific needs for this demographic. Efforts have been made to address gender inequalities that contribute to young girls' vulnerability to HIV infection. By promoting gender equality, the government aims to empower young girls to reduce their risk of HIV/AIDS. Community-based programs and outreach efforts have been employed to raise awareness and provide support to young girls at risk or living with HIV as well. The international response reaches here in the United States as well as worldwide in many developed nations as well as African nations. The Global Fund to Fight AIDS, Tuberculosis, and Malaria has been a major contributor to the fight against HIV/AIDS in South Africa. It provides financial resources to support prevention, treatment, and care programs, including the distribution of antiretroviral drugs and other essential services. PEPFAR is the United States government through the State Department. They have played a crucial role in supporting South Africa's efforts to combat HIV/AIDS by providing funding, technical assistance, and capacity building to improve HIV prevention, treatment, and care services. The World Health Organization has been actively involved in guiding and supporting South Africa's HIV/AIDS response. It provides technical expertise, guidelines, and recommendations for effective prevention, treatment, and care strategies. United Nations Aid, or the Joint United Nations Program on HIV/AIDS, works with the South African government and other partners to coordinate and strengthen the national response to HIV/AIDS. It also advocates for increased resources and improved policies to address the epidemic. The DREAMS partnership focuses on addressing the high rates of HIV infections among adolescent girls and young women in sub-Saharan Africa, where they're disproportionately affected by the epidemic. While efforts to prevent HIV/AIDS transmission in South Africa have been present for decades, consistent and effective actions must be taken to protect the lives of young girls at risk and therefore protect future generations. Increased testing and awareness promotes the widespread testing and counseling to ensure early detection and linkage to care. Education and awareness campaigns should focus on reducing stigma, encouraging regular testing, and educating the public about prevention strategies. Access to antiretroviral treatment is also crucial. The access to this treatment for all individuals living with HIV, regardless of their socioeconomic status or access to health services, are important and must be highlighted in the fight against HIV/AIDS. It is also important that we focus on targeted interventions for at-risk populations, in this case, young women. The implementation of targeted preventions and treatment interventions for key populations at higher risk of HIV. This could include not only young women and girls, but also sex workers, men who have sex with men, and IV drug users. Another key strategy that could help in the fight to end HIV/AIDS in South Africa is promoting gender equality. Addressing underlying socioeconomic and gender-related factors that increase vulnerability to HIV infection among young women and girls, promoting gender equality, women empowerment, and initiatives to prevent gender-based violence could greatly influence the rates of HIV transmission. Community engagement and involvement is also crucial. Engaging communities in the development and implementation of HIV/AIDS program and community-based organizations, they play a vital role in providing support, education, and reaching underserved populations. Another important strategy would be to implement youth-focused programs. Developing targeted programs for adolescents and young adults to address their unique needs and vulnerabilities concerning HIV/AIDS can really reach the ground on what this epidemic means for young generations. This was a brief overview of what my presentation will look like. I hope you enjoyed, and I do have a lot of work to do, but I am quite excited.